This is the next case in the RadCoPilot in Action series, and here we have a multi-phase CT abdomen pelvis in a 60-year-old female with known cirrhosis who has presented with a liver mass identified on surveillance imaging. And we have non-contrast arterial phase, portal venous phase, and delayed phase axial slices here for us to look at. So let's start in the arterial phase images, and we can immediately see when we look at the right lobe of the liver that there is this large heterogeneous high attenuation mass centered really on segments 5 and segment 6. This is really high attenuation. We suspect that's because it's enhancing in the arterial phase, but we can look across to our non-contrast images and see that, yes, indeed, it wasn't natively of high attenuation. So that's arterial phase enhancement. And let's have a look at the rest of our liver, see if there's any other lesions. Generally looks okay. We can look at our portal venous phase images. This is a good opportunity to look at the rest of the abdomen. We can see the patient has splenomegaly, large looking spleen, and we can see all these prominent vascular structures here just lying behind the stomach. And those are typically appearing varices, and we can see they come up here to lie around the outside of the distal esophagus as well. So those are esophageal varices there. And on our delayed phase imaging, we can see there is the impression of washout here, with the area of the lesion itself being of slightly lower attenuation than the surrounding normal liver parenchyma. So let's start writing some stuff. So we can say large, maybe we could say greater than 10 centimetre mass, the right lobe of the liver, centred on segments 5, 6. We could say arterial phase enhancement, washout on delayed images, no further liver mass. What else can we say about it? We could say there is no internal calcification or hemorrhage. And then we need to mention splenomegaly and varices. Now, one thing I think we need to talk about when we're thinking about liver masses, particularly in patients with cirrhosis, is whether this is typically appearing for hepatocellular carcinoma. And we can use this system called LI-RADS, which is our structured reporting system for liver masses in the setting of cirrhosis when we're thinking about hepatocellular carcinoma. And it would be useful for us to make sure we're ticking all the boxes and commenting on all the things we need to comment on in order to give this a nice LI-RADS category. So let's say, what else do I need to look for in this scan to give an accurate LI-RADS CT classification? Just to make sure we're looking at all the right things. So we commented on arterial phase hyperenhancement, that's good. We commented on the washout appearance, that's good. We haven't commented on whether or not there's an enhancing capsule, but it says you look on the portal venous or delayed phase images. And when I'm looking at both of these sets of images, I'm not really getting the impression that there is an enhancing capsule around the lesion. So we better add that to this report. So no enhancing capsule. And what else can we say? Threshold growth, well, this is the first time we've seen the lesion, so we can't comment on that. The size we've done, we haven't commented on whether there's tumour in vein, so let's have our portal venous phase images. We can see the portal vein looks nice there, no evidence of invasion. And we can't see much evidence of anything within hepatic veins, although they're not particularly well opacified on the images we've got. Are there any non-HCC malignancy features? Okay. Targetable appearance, diffusion restriction, of course, is for MRI or infiltrative appearance. No. No additional lesions and background liver lesions. Okay. So, so let's say, what LI-RADS category should I give? Okay, so it's suggesting a LI-RADS 5, and I would agree with that. Okay, so let's make sure, let's look at the rest of the scan, make sure there's nothing else we're missing here. There's no ascites, is there? We should mention that. And I'm not seeing anything else of note on my review of this case. So let's finish off here. So let's generate a report. We can get rid of that. That from the top, that's good. Large mass, 10 centimeters. Okay, good. We're going to add in our LI-RADS score. Good, and we can finish it there.